I'd like to invite our next speaker, Dr. Youlin Qiao, from the, he's the Director of Cancer Epidemiology from the National Cancer Institute in Beijing, China, and he's going to talk to us about HPV testing in China.
Okay, thank you. And today, I'm very happy to share our experience and for the HPV-based intervention and in China. My talk, I have about 4 parts. And first of all, I want to talk about the hybrid capture test, which is very popular in worldwide. And the second one is the major presentation is the HPV, which was just get a licensure in China. And the third one is the population-based implementation in China, and the last one is summary. So you already know why HPV test is important in low and resources countries. And I just give you an example in China. Our first nationwide cervical cancer screening initiated by the Ministry of Health during year 2009 and 11. So that program only covers 10 million and rural women's and between ages 35 to 59. So that number only accounts for 7% of the women that should be screening through the 3-year and time. And if we keep that way, and that will take about another 40 years, and screening once for all 142 million women in the rural area. And also it's not including the women in the city. And the screening and tools use the pap smear and the VA and the VD. Depends on the hospital who has the skillful. So the most low-resource countries cannot wait to pay the high price for such avoidable delay. So we need a new test. This is the screening and method we already implemented in many hospitals, including VA and convention cytology, liquid-based cytology, and also HPV DNA test. In the city, I think that is all right because we have the better and personnel and the facilities. And this is the slide shows you, and for the past over 10 years, and we did over 18 population-based screening study in China, and we evaluate all of the screening tests, and this is the location of our screening studies, and this is a major result, and my student published in Lancet Oncology, and for the HPV DNA test, which is a hybrid capture. And also this is when we're doing the screening studies, we comparison the doctor sampling and also the women self-samplings. In many areas in the rural China, the people they have difficulty to transport to the countryside, particularly in the Xinjiang, in Mongolia, and Tibet, many areas. So we try to evaluate if self-sampling can serve the same function. So this paper published in JNCI gave us the very promise, the result, and even just the little device and collect some and samples from the woman's vagina, so we can get the very good sensitivity and relative good and specificity comparison, and with the cytologies. And so after those population-based study, and this is data shows you, and we are planning the study and finish that study. So we call the STAR project, which is the collaboration between the China National Cancer Centers and also the India collaborators and from the Sankar and the Tata Memorial Hospital, and 2 teams and from China and India. So we spent about 5 years to try to work on this new screening test. So you can see the number, and here is equal about over 10,000 women recruited from our different site, and the total is over 22,000 women. This is a machine, and you already see from the previous and the presentations. Sorry, and the result is quite obvious. It's very simple, and you can read the positive, for example, very easily to handle. So the operator of the machinery is just some nurse or some medical and technologist. So they are working in the Women and Children's Health Center in the county level. And finally, the result published in Lancet Oncology gave us very good and the sensitivity and the specificity if you comparison with the hypercapture, which is the standard and screening test in city. And so these products finish the development phase, then move to we call it registration trial, and which is including our cancer center and Sun University Hospital in the Guangzhou, and another Nanjing University and Gulu Hospital. So we did a Chinese FDA registration trial, and we finished our trial, and so they get the CE marking certification is very quickly in the year 2010, but that takes so much time to get the Chinese FDA approved because China is the country they actually produce these products, so they are not just require the trial data, and also they want to do the site visit and manufacture the plans. So that takes time. So even in year 2010, when UICC had the Cancer Congress in Shenzhen, so we did the visit, and you can see and here, this is the slide shows you, and we visit the Shenzhen manufacturer plant, and this Dr. Franco and Dr. Sankar's, and since August 2010, so 2 years passed, we eventually get our government licensure. So now the products officially can be produced and also can supply to another countries. And the last part is our population implementation of cervical cancer screening. And in year 2005, and I did the demonstration project. So I selected two places. One is in the low resource setting in the Shanxi province, and another one is a city, as in Shenzhen, which is the new city, just 20, 30 years, and next to Hong Kong. And I tried to get some information for the government, and when the government want to implement the cervical cancer prevention, so our demonstration project get a report from Lancet Oncology. And after that, and the government, they only took the result and from the countryside, and because is the way and procedures. So in the city, we promote HPV DNA test. At that time, the year 2005, there's no HPV, so only hypercapture. So the government thinks hypercapture is too expensive, so they just take the city model. So from year 2009, the government launched the program, just as I said in the beginning. So they want to screen 10 million women that's in the countryside, because the VID just cost less $10 per test. And but the Chinese and the working union, they are not happy, because they are the representative of the urban and the women. So they wrote some and appeal and to the central government. Then they get some money to start some demonstration just last year. So they want to do the program for low-income females or migrant workers in the urban area. But that's just the beginning. It's not national programs. And so this is shows you the two and the slide, two sites. We start from 26, then and they come to the all 43, and the counties they already and have the centers to deal with cervical cancer prevention programs. And so our programs get the worldwide attention, and then they publish the editorial, and also talk about the challenge, because any successful programs need to evaluate and for the longer time. And so now we face the challenges, and also we have some solutions, because according to our Chinese, the government ambitious the goal for women and children's health plan by year 2015. So they want to 70% of all women, and from the ages 35 to 59 will get a screening, and once for every 5 years. And the treatment surveys for cervical and breast cancers, and also other common genital diseases such as STI. And then if you put the urban and the rural area together, so that's reached to the 270 million women we need to handle. So this is huge challenges. So when we just deal with 10 million women screening and takes us for 3 years, but now this year, the government and move to the 30 million. So they want to do another 3 years program to move from 10 million to the 30 million. But that's still the shorter and supplies. And even in the second round of screening, because the HPV is not get licensed yet, so the government still promote VIVD and pap smears. So now this year, so we want to move to the HPV-based test, because our health systems cannot handle so huge demands. So now we are planning the cervical cancer screening by HPV. We call it HPV introductory trial. That's just like the past did their study in the Vietnam and India and some other countries. We want to show the government the VIVD, pap smear, and the HPV in the 14 counties. The sample size is about 3,000. So after we finish these programs, I believe the government eventually can take the HPV DNA as a national program. So of course, and many people talk about the HPV vaccine, but I'm very sorry to tell you, in China, HPV vaccine is not available. And then when the two countries did the trial, that's the international trial, and Merck and the GSK trial, they are not including the participant from mainland China. So they have the participant from Hong Kong, Macau, and Taiwan. So those part of the land, even we call it belongs to China, but the participant and they have the vaccines. But so many mainland China people, they want to get a vaccine, so they have to travel to the Hong Kong, Macau, or Taiwan to get the vaccine. So these two vaccines now is in the new trial, in China almost 3 years. But since there's no recommendation to use another endpoint as the result, so our SFDA still require CN2+ as endpoints and for the trial. So we are now still waiting for the final results. So last, my summary is the HPV test is a highly sensitivity and a moderate specificity test for CN2+ lesions, and is approaching that of hypercapture 2. And the HPV test is viable options for large-scale cervical cancer prevention screening in low-resource settings, and also expanding and improving the capacity of demonstration centers, networks, and consortiums, and move the program from the rural area to the city and to whole nations. So implementation of feasible technology approaches to screening cancer in low-resource setting, and reducing the inequity in access to the screening, early diagnosis, and quality care remains challenging. Of course, we always need the government support. Thank you for your attention. I'm finishing here.